Welcome to the Artist of Science, this time from Ritz-Carlton Hotel in Roppongi, Tokyo. It is a pleasure and honor for me to be with Dr. Okada and speak about her successes and her life. Dr. Okada, again, a pleasure to be with you, and it's a great opportunity to speak about your life achievements. So that's where I want to concentrate first, shortly and in concentrated form. Tell us about your career, your successes, and how this have helped people.
First of all, thank you for your to have such a great opportunity to have to speak with you and you. And first of all, I have performed multidisciplinary combination therapy for more than 2 different types of carcinoma, and I have cured patients with 4 incurable conditions of cancer, namely metastasis, dissemination, and local progression and recurrence. Maybe around 2,000 people is not so cured, but have great long time
life.
After prognosis.
From a short prognosis, very long. But 1,000, this is big success story.
I think so. This is my life work. So
yes, it's very impressive.
Well, may I show the case of for sorry. This is a case of locally advanced pancreatic cancer. As for local advanced pancreatic cancer, the cancer surrounded the important blood vessel, so can't be resected. So
cannot be
resected. Removed.
Removed, correct.
A patient with the pancreatic cancer come to the one patient comes to my hospital with the disappointment, and because 1 year survival rate for inoperative pancreatic cancer is about 10%, only 1%. So he is so disappointed, and even if it can be operated, the 5-year survival rate is only 8.5%.
Survive.
As for pancreatic cancer, but his case is only 10%. So I treated him with the most effective radiotherapy, heavy ion radiotherapy.
Heavy ion
radiotherapy. Radiotherapy for treatment to resistant cancer.
This is a new type of radio? So it is a new development from you, this new type of... And the exact name is?
heavy iron radiotherapy or
Heavy iron radiotherapy.
or carbon ion radiotherapy.
Or carbon ion.
Yeah.
And these are new radiation technologies
Yeah.
that you have developed.
Yeah. We Japanese people, doctors
Okay.
developed. Yeah.
Okay.
And I was responsible for the pancreatic cancer and the liver cancer, and I was organ director for liver cancer at QST, this hospital.
Mhm.
And this facility at QST hospital is the size of a soccer field,
Mhm.
very big one. And synchrotron accelerate carbon ion to the top speed of 8% of light.
Mhm.
So very speedy.
Uh-huh.
Extremely intensive radio beam hits only the affected
Localized
area.
effect.
Localized, just like.
Just localized
Yeah.
effect, so
Yeah.
it doesn't damage the surrounding.
Yeah, exactly.
Mhm.
Yeah, it allows the double strand breaks. So localized regions were completely controlled.
Mhm. Mhm.
But unfortunately, at his case, only 2 months later, he had several multiple liver metastasis.
From the pancreas.
Yeah, from pancreas.
Okay.
Yeah. So he underwent the hepatic artery infusion.
Which is.
Uh,
What is the hepatic artery?
Hepatic artery infusion is a treatment in which very concentrated anti-cancer
Mhm.
drug is injected through the tip of a carbon tip of catheter.
Catheter.
Yeah.
Mhm.
So through the tip of a catheter located near the tumor.
Mhm.
Yeah. And the tumor is disappeared.
Mhm. It shrank and disappeared.
Disappeared.
Mhm.
But on 3 residual lesions there. So he received radio frequency ablation, and residual area is there.
Mhm.
And
But these are new ways of treatment, correct? These
Yeah.
are not the routine treatment.
no, not the routine.
These
So,
are new
yeah.
treatment that you have developed.
Yeah. So this treatment is very new, and this is not so new, but not so popular, not so common.
Mhm. Oh, the
Yeah.
catheter.
Just the treatment,
Is this ambulation?
and also hepatic artery infusion and RFA, radio frequency ablation. So
all these are new techniques that you have been developed successfully. You have used successfully.
not so old one as for this hepatic artery infusion and radio RFA, but combination is not so
Done.
common.
Correct.
Yeah.
Combination of all these methods.
Yeah.
So they existed before, but you achieved a correct combination of this method
Yeah.
in order to achieve the results.
The result?
A good result. to
Yeah,
see.
very good result.
So your achievement is a combination of all these methods
Yeah.
in order to be successful and
Yeah.
treat their cancer.
Yeah. Actually, we can cure his pancreatic cancer, metastatic pancreas cancer. So 1 year later, he has no residual lesions.
Wow. So he's no cancer free.
Cancer free. Yeah.
Okay.
Yeah.
So there are 3 methods that you are using successfully in a very specific way by
Yeah.
combining that.
Yeah.
Combining them in your within a technique that you have developed.
Yeah.
And then this combination of these three techniques have been used in more than 1,000 patients, correct?
Yeah.
And successfully.
Yeah.
Amazing.
Yeah. And as for this peritoneal dissemination, a patient suffering from colon cancer and peritoneal dissemination. I'm sorry. He had HIPEC and CRS.
What is HIPEC for the public that is not a doctor?
I see. First of all, CRS is a surgical procedure to remove all the tumors to extent possible.
Okay, so he removed the surgical procedure to remove the cancer.
Yeah. While HIPEC, HIPEC is a hyperthermic intraperitoneal chemotherapy, is a treatment in which anti-cancer drug heated to 43 degrees Celsius and returned into the abdominal cavity to kill the cancer. It takes advantage of the fact the cancer is heat sensitive.
It's heat sensitive.
Yeah. The treatment is very hard, but he is an opera singer and active in Europe, so he did his best to sing. After 5 years, he continued to sing without residual lesion. No residual lesion 5 years later.
Wow. Okay. So all your life dedicating to helping people beating cancer.
Yeah.
Wow. So how and you are fulfilled. You enjoy this kind of profession. Helping people. And being cancer professionalist. I'm happy for the patient cure. Yes, that's major. It's a major achievement.
I can share the happiness with my patients. I like my job. So
yes, I see. What's the story? How you went to cancer? From the beginning, we dealt with cancer.
Become oncologist.
Yes.
So I happen to be.
It was by chance or it was by goal?
By chance.
By chance.
Yeah.
Why by chance?
I had that position, so near my home.
So you had. I didn't understand. You had that position.
I had the position specializing chemotherapy. Near my at the hostel near my home.
Okay. Okay. So you worked there first.
Yeah.
And then you became fond of this cancer treatment, and you. So for how many years you are doing this, helping people fighting cancer?
Yeah, more than 10 years.
More than 10 years. And about 1,000 and more people happy with the treatment and saving their life or prolonging extensively their life. And so if you go back in years, would you have chosen the same career?
Yeah, absolutely.
Absolutely. No regrets. Okay. In this point of view, so what is the best decision as an oncologist you have done in your life?
Yeah, I chose to be oncologist.
This was the best. And which one was not so good that you regret?
I manage a company. It's hard for me because business is なんていうかな。
Different.
Kind of money matter, so.
Oh, okay,
Yeah,
okay, okay.
yeah,
So different nature.
Yeah, yeah.
So this is a little bit more difficult
Yeah.
because it's outside of the passion
Yeah.
of biochemistry and cancer.
Yeah.
Okay.
No career.
So, but you know, how many all this new development, new treatment that you have developed, and you have saved so many lives. How many hours per day you work normally?
More than half of the 12 years hours or so.
More than?
More than 12.
12 hours.
Yeah.
12 hours per day.
Yeah.
So, and you enjoy 12 hours
Yeah,
per day.
I enjoy.
So 12 hours means, let's say, from 8 to 8.
Yeah. 6 to 6.
6 to 6. Okay, so you start early in the morning. So
Yeah.
early bird.
Yeah.
And but that's good because you finish at 6 and start at 6. And after 6, what do you do?
Maybe cook.
Cooking. So you cook yourself.
Yeah. And take a bath or
I think, sorry.
take a bath or talking with my family.
Oh, okay,
Yeah.
okay. And but this is a good combination. You start at 6 and finish at 6. Because some people start at 9 and finish at 10. So your family doesn't complain sometimes. You're working too much. You are not concentrating more time to us.
No. As for my family,
Yeah.
my happiness is their happiness.
Exactly.
Yeah.
Exactly. So after 6 o'clock, there is no more work. You concentrate to the family. After 6.
Yeah. Reading or
Everything. So
sometimes studying.
yeah. So how much free time you have?
How much
Free time
Maybe 2 or 3 hours.
per day.
Yeah, per day.
Okay. And since we are here, what do you do with the free time? What do you do during the free time?
Yeah, cooking.
Cooking. So you love cooking.
Yeah, cooking.
You are a good cooker.
Cooking はなんかこう、wash dishes. This is it's my hobby.
Yeah, wow, really, it's a hobby. Okay. So you like doing that? You like doing that? You like, it's a hobby that you like.
Like?
You like. You
Yeah,
like it. You like doing that.
You
You enjoy doing that.
Yeah, absolutely.
You enjoy, okay.
Sometimes make bookshelf or
Okay. What about sports? What about
sports?
yeah?
Yeah, I like tennis or
You play tennis
golf.
and golf.
Yeah.
How frequently you play tennis and golf?
Yeah.
How frequently? How many times per month?
Not so
Per week?
Not so often because
Yeah,
I'm
because
so
you're busy.
busy. So.
Yeah, that's what I understand.
Yeah. But I love golf or tennis. So.
Yeah.
Sometimes baseball.
Yeah, that's baseball. Baseball also.
I like baseball.
Oh, really?
But no chance.
It's not so popular in Japan,
Yeah.
in
but,
Asia,
no chance to
to practice.
play, so.
So you apparently are doing a good balance of life and work. Because you start at 6 early,
Yeah.
when everybody I guess is sleeping.
Yeah. But the morning, I like morning times.
You like morning.
Yeah.
This is good morning, by the way.
Yeah.
Why it is good?
Clear and.
So basically you wake up at 5? At 5 a.m.?
5 a.m. Yeah.
You wake up at 5 and just...
around 5 a.m. and the なんていうかな brain is clear. So.
Are they clear?
Yeah. And.
So the most productive time is early in the morning.
Yeah, I think so. Yeah.
That's very good to know.
And positive mind ね。
Positive mood.
Yeah.
That's good because myself I don't do it normal. Sometimes I'm early, sometimes I'm late, so I don't keep the same. But this is good. So you start at 6 o'clock in the morning.
Yeah.
And what time you sleep in the evening?
To 11 p.m.
11 p.m.
Yeah.
And you wake up at 5, 6 hours like me.
Yeah.
That's all I need, 6 hours, not more. That's the life of a famous oncologist. So the secret is to start working at 6 o'clock in the morning. So because you are clear, everything is clear, and the most productive time is in the morning or afternoon. The most productive when there are good ideas.
Yeah, in the morning.
In the morning.
Yeah, absolutely.
Okay. So I never started working at 6, by the way. Unless if I am in Japan, yes, because the difference of hour.
Yeah.
But it's a good idea to try. In 6 o'clock in the morning to wake up. Everybody's asleep and you are ahead of everybody. You are ahead.
Yeah.
Everybody's behind you. They have not slept. They have not woke up yet.
Yeah.
Well, that's very interesting. So, if somebody from doctors that develop new techniques are very busy.
Yeah.
And sometimes the young generation say,
Yeah.
why I should be a doctor? It's better to be, I don't know, sociologist, banker, because you make money easier.
Yeah.
You don't think a lot. So, what you can say to those people, young generation, why they should go to medicine?
The most I like the verb. Mercy is work for others, and if I do good thing for someone,
for the others,
or maybe come back to me. Yeah, I like this.
This principle. This principle. That's perfect.
Principle.
Yeah, that's principle.
Yeah.
So this is why young generation people should come to medicine.
Yeah, I think so.
To help humans.
Yeah.
And help each other.
Yeah.
Because this way, everybody will be helping each other, and will be a sustainable society.
Yeah.
So, but they are afraid of hard work. Some of them. Some young people are afraid. They say too much work, very hard work.
It's better to enjoy the hard work.
It's better to enjoy the hard work.
Yeah.
Because.
Yeah. Because just enjoy our work and make me better. Better. 成長なんていうかな成長ってなんだっけ
No, makes you
make me
feel better.
Feel better and bigger.
And bigger.
Yeah.
So makes you
as human.
As a human. So it makes you a large human being, a big human being.
Yeah.
So helping the others is the key.
Yeah.
And I imagine that all these people that you have saved their life, so their joy comes to you.
Yeah.
Is returned to you.
Yeah, I think so.
And this is very, very fulfilling.
Yeah, I think so.
That's very fulfilling.
Yeah.
So you said that better enjoy the hard work.
Yeah.
Which means it's not work. Correct?
Yeah, correct. Yeah.
Because if you enjoy the work, it's not a typical work.
Yeah.
It's something that you enjoy.
Yeah.
And do you always stop at 6 p.m. the work?
Yeah. I can't sometimes always can't be stopped.
Exactly. Yeah. So that's because you do new development.
Yeah.
So you don't do routine.
Yeah.
Not routine medicine.
Yeah.
You develop always. You have a challenge every day.
Yeah.
It's
very comfortable for me. Yeah.
Because this is new. It's not routine.
Yeah.
And the routine keeps you young, keeps you, active, and keeps you. And if you do not do routine, if you do routine, it's not something that makes you develop, correct?
Yeah. If I develop, I cure much more patients. So,
Patient compared to other, because and this is this challenge at the work, you like it.
Yeah.
Because I guess each patient is different, and you have to find a specific solution to cure their cancer. But you know that there are many cancers. People suffering with cancers around the world, and most of the doctors say to them, "Oh, there is no more. There is, you do not live for long. We'll try to keep you." But not too many doctors give positive thoughts to patients. So, in your case, you always try to find solution individual for each patient.
Yeah. Because my patient is like my family. So
exactly. Okay, that's why you always feel and. You get inspired doing saving their lives. It's not just work; it's also an inspiration. And this is for how many years? How many years of work you have done this? For how many years?
How many years?
Doing this work.
How many years? Maybe what? About 8 or 8 years.
18. 18 or 8?
10, around about 10 years.
10 years. 10 years. And 10 years you have been so successful.
Yeah, because the cancer therapy is not gonna change better,
change the morphology, change it, it adapts. It adapts to the new treatment. So each time you have to find new treatment, correct?
Yeah. And cancer therapy developed very speedy in these 10 years. So.
Oh yes, it's a speed development. Yeah. But the technique you are using are unique. The others I have not seen the others using our technique. Correct?
Yeah.
You are very, very unique, and you have developed yourself by combining different techniques.
Yeah.
And this is the key of the success.
Yeah, I think so.
Yeah, that's amazing. So, other people are not, our doctors are not using the existing techniques in a good combination to save lives.
Because there are many good, talented doctors, and I combine their techniques for one patient.
They do not combine it. Well, you are combining them. That is very, very, very important for the success. The combination of techniques. And so all your technique, the combination of techniques is unique, and no other doctors can do that.
Maybe no other.
Yes. So if somebody...
It's not popular.
Yes, but very successful.
Yeah, I think the combination therapy is very effective for cure the patient, but not popular because there are standard treatment is very popular. So.
Well, popular does not mean always is better.
No, not better.
Not better, because
splendid. Standard treatment is spread it. So our combination therapy is not spread it. And not distributed. So.
Yes, but it's not so important if you have so many successes. And you have cured so many patients. So, but this is how medicine is developed. If we work within the standards, nothing new is developed. So we have to go out of the standard and develop new things. Otherwise, you know, and the standard practice is chemotherapy, it's radiation, and then makes life of people miserable. Sometimes the life is more miserable because of the chemotherapy than from the cancer itself.
Yeah.
Correct.
Yeah.
And your combination, do they have any side effects?
Most effective and
less
adverse effects.
Less adverse or side effects that we normally use. So this is major, because there is an expression that says that you will be killed by cancer or by chemotherapy.
Sometimes killed with chemotherapy, but as for my treatment, it's okay.
But generally, so if you go with the standard techniques, they're saying chemotherapy change all the time, and the side effect is so much that they can kill you even faster than cancer. Correct? Is this a good definition, or?
I don't think it's good.
To repeat and to repeat and to repeat, and the quality of life of patients become very bad.
Very bad, I think so.
Yeah. So in this case, you have a new technique, a combination of existing technique, specific for each patient, very successful, and with much less side effects.
Yeah.
And this is something that it's and you enjoy developing new things.
I enjoy. Yeah.
And so the young generation should do the same.
And
they should enjoy trying to do not routine work. But to develop.
Challenge is a very good thing. Maybe challenge makes their life very happy and very happy.
So challenges makes your life very happy.
Yeah.
This is the best line which you have to use to finalize this interview, which is actually what you have done all your life. You challenged yourself, and you're happy challenging yourself and developing new techniques, and then challenging again.
Challenge to cure patients.
Challenging to cure patients. Well, Dr. Okada, it was very enlightening, this conversation with you, and people should feel, optimistic if they have any cancer treatment that didn't work, that other doctors, showed them there is no more, there are no more options. They have a solution in your work. 10 years of hard work, full of challenges, and enjoying challenges and developing these new techniques, and more 1,000 patients that have seen your good results in saving their lives, and this is major. Today, Dr. Okada, cancer is a big mammoth. Everybody's afraid. They should not be it anymore. So if they are really in bad position, where they don't know where to go, and here it is, the solution. So we're gonna put the doctor's name, Dr. Okada, at the program, so they can contact you. But this is a major thing, and really we congratulate you for these achievements. And again, it's a pleasure and honor speaking with you.
Me too. Thank you.
Thank you very much. We really appreciate. We really appreciate.
You too. Thank you.
ありがとうございます。